Read the table with words from the opposite. Put a street make in front of the street, streeting syllable in each word. The first one has been done for you. Now, exhaustion, fatigue, lethargy, tired, tiredness. Adjective, exhausted, fatigue, fatigue, lethargic, tired. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Complain of color, of sort, present with, put on, and worn out. Complete the sentence with the correct form of the verb present. Number 1. A 67-year-old man present with a 9-month history of increasing short, shortness of breath. Number 2. The most common presentation is loss of consciousness. Number 3. Cranial arteries T may present as fever without any obvious cause. Number 4. The patient usually presents with a severe sore thorax. Number 5. The presenting symptoms in this patient could perhaps be due to renal failure. failure. Number 6. Other conditions with a similar presentation include a cold, cholecystitis. Number 7. Reduced Crohn is an important presenting complaint of colic disease. Number 8. 2 months following presentation, the patient was able to walk. With a patient's description of her symptoms, they complete the case report. Look at C opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and big tired. But latterly have I been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I put on 9 kilos in the last year. My motions are hard and my hair has started to fall out. A 50-year-old housewife who had been with YouTube for months previously, tired of tiredness and malaise. She had gained 9 kilograms in 20 in the year before she presented to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair had started to fall out. Find words in the box with a positive meaning. Look at B and C apposite to help you. Adequate, against, unlikely, savoring, meal, rare, common, sudden, insidious, inadequate, for, and likely. And adequate with inadequate, unlikely with likely, and rarely, common, and savor with milk. Make word combination using a word from each box. Look at B and C apposite to help you. Bone with marrow. Differential with diagnosis. Insidious with onset. Iron with deficiency. Permission with alignment. Progressively with increasing, and vibration with sense. Complete the sense. Look at A, B, and C opposite to help you. Number 1. A 13-9-year-old man present with a story of progressive abdominal distension over a period of 6 months. Number 2. Bleakness may be caused by vitamin A deficiency. Number 3. The bleeding and purpura are caused by abnormal palpable fusion. Number 4. The white cell count is normal, so we can exclude acute leukemia. Number 6. There was a palpable mass in the right upper quadrant of the abdomen. Number 7. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. And 8. The anemia may be due to increased red cell breakdown. Complete the conversation. Look at C opposite to help you. Profession. What is against the diagnosis of pernicious anemia on site physical examination? Student. The problem starts with suddenly, so it didn't have the typical insidious onset. He doesn't have any skin pile, and he doesn't have symmetrical characteristics or onset, vibration sense, and I could feel this explain. Profession. What about this token? Student. This token was normal and not inflamed or scarred. Over to you. List a cause of anemia mentioned in the conversation in B opposite. They chose another condition that you encounter regularly and make a similar list of the cause in English. Bleeding, loss of blood, excessive destruction of the red cells, low production, for example, cause the death is looking on deficits in iron, deficits vitamin B12 or folic acid. Label the diagram using words from the box. Look at A apposite to help you. Number 1, school. Number 2, jawbone. Number 3, Spain. Number 4, breastbone. Number 5, rib. Number 7, collarbone. Number 6, collarbone. Number 7, shoulder blade. Number 8, thigh bone. Number 9, kneecap. And number 10, shin bone. Match the types of fracture 1 to 5 with the description A to E. Look at B opposite to help you. Number 1, open. Is A. There is a break in the skin. Number 2, communicate. C is the bone is broken into several pieces. Number 3, displaced. B, the bone is bent. It occurs mainly in children. Number 4, queen's stick. D, the broken pieces are temporary. And number 5, impacted. E, the broken pieces are pushed together. Complete the text box strike. Look at C opposite to help you. Number 1, producing a fracture involves training to return the bones to have near to their original position as possible. If a fracture is allowed to help in a displacement opposition, the fracture will unite, but it may go to malunion. Complete the table with words from A and B and C opposite. Then complete the sentence with a word from the table. Verbs: delay, develop, distance, fail, nourish. No, delay, the development, distinction, fiber, nourishment, nourishment. Adjective, delayed, beloved, dissented, filing, and nourished. Number 1. Babies with the fetal alcohol syndrome may present with 5 to drink. Number 2. Abdominal distension may be due to an enlarged liver. Number 3. Small amounts of alcohol in pregnancy can affect fetal development. Number 4. Mortality from measles can be reduced by better nourishment. And number 5. The play in one or more of the milestone may be the first thing of this. Complete the sentence. Look at A and C apposite to help you. Number 1. After sitting, babies learn to crawl and then to walk. Number 2. A child who has started eating solid food has been weaned. Number 3. Someone who is not very tall is said to be of short stature. Number 4. The stages in a child's development are known as the milestone. And number 5. A child who is beginning to develop sexually has read puberty mortuary. Write the common English name for each disease using your medical knowledge. Number 1. Enlarged parotid gland mons. Number 2. Difficultly opening the mouth. Lockjaw. Number 3. Rash and enlarged posterior occipital nodes. German meals. Number 4. Paroxysmal cold with vomiting. Whooping cough. Number 5. Painless and basically freeze on truck. Chic and fast. 6. Cold and cold following with rash meals. Sore throat and rash spotted fever. Number 8 is a rolling joint and a hair murmur. A rheumatic fever. Number 8, fever followed by muscular weakness, polio. And 10, cold with a stridor crow. Complete the table with words from A, B, and C apposite and relate from. But a street make in front of the street stylably in each word. The first one has been done for you. Verbs in event, produce, release, replace, secret, stimulate. Noun, envision, production, release, replacement, secretion, stimulation. Complete the passage from the textbook using the illustration and your own knowledge. Look at B apposite to help you. Pulse of GnRH gonadotropin releasing hormone are released from the hypothalamus and stimulate LH and FSH release from the pituitary. LH stimulation, testosterone production, from leading cells of the testes. Testosterone feeds back on the hypothalamus pituitary inhibit GnRH secretion FSH. Triggers the sertoli cells in the cymiferous tubulus to produce mature spleen and the inbine A and B. Even cause feedback on the pituitary to decrease FSH secretion. Complete the sentence. Look at A and C apposite to help you. Number 1. A diffuse change affects many parts of the organ or gland. 2. A localized change affects only one part. Number 3. His diet is deficient in iron. He doesn't have enough iron. And number 4, excess T3 and T4 increase the body's metabolic rate. Match Mr. Davis' symptom 1 to 7 with the question her doctor has A to H. Look at the opposite to help you. Do you prefer hot water or cold? Is heat intolerant? Is your wearing a steady? There is wearing loss. What is your appetite like? Eating more. Are you blowing normal? Diarrhea. Are you able to sit and relax over activity? Do you hands shake? Try more. And have you ever felt your heart beating rapidly or regularly? Palpitation. Complete the table with words from be apposite and relate from. Verbs: accommodate, constrict, converge, delay, drop, oscillate, rest. Noun: accommodation, constriction, convergence, dilatation, oxidation, and reaction. Adjective: constricted, delayed, and dropping. Mark the victory and 1 to 6 with the coordination F to A to F. Look at B opposite to help you. A, dropping of limbs, number 6. B, delayed peoples, number 3. C, irregular people, number 2. And D, cataracts, number 5. And E, skinned, number 1. And F, constricted people, number 4. Complete the extract from textbook. Look at C opposite to help you. Retinoscopy. Examine the retina with an ophthalmoscopy of possible with the people relate to obtain the maximum view. Look for papilloedema, papilloedema and for flame shaped hemorrhages and dog wall exudate. Assess the state of the artery and not the presence of any narrowing, as well as ripping at artery venous cross. Complete the case report. Look at A, apposite to help you. Case 14. Physical examination revealed a thin girl with slim figure. She was not obviously dehydrated. The temperature was 38 cells plus 100 for minute, blood pressure 110 for 18 mercury. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalist tendons, which was most marked in the right lower. Wording and was associated with wording, but not read it. There was no rebound tendency and no misses. Were filled, vowel sounds were reduced. March, the description of the stool 1 to 6 with the coordination most likely to cause them A to F. Using your medical knowledge, look at B apposite to help you. Tape of stool. Lows loading with cholera, lows pale bulk with colic disease, clay chloride, gastric use, black cherry, obstruct, jaundice, small heart, irritable blood syndrome, and clear, watery, with muscles, with ulcerative color. March the features um, um, 1 to 7 to the doctor's questions A to H. Look at B opposite to help you. How often do you open your blower? Blower habit. Are you going to the toilet more often than normal? Consistent. Are the motion hard or loose? Bulk. Do you do the motion have an unusual smell? Change in blood habit. What about the appearance of the stool? Blood. Have you faced black stool colors? And is the size on the amount of the stool normal? Is offensive age of the medical terms below using your medical snuggling. Look at A and B opposite to help you. Number 1, hysterectomy, surgical removal of the uterus. 2, menorrhagia, a prolonged menstrual period. And salpingite, pallium tube infection. And 4, cervical biopsy of the neck. Read the conversation between the gynecologist and the patient in C opposite and complete the note about the patient. Menarche, 12 years. Menstrual cycle, 4 or 5 days. LMP, last menstruation period. Menorrhea, no. Dysmenorrhea, no. Discharge earlier. Now write the question that the doctor asked. Look at C opposite to help you. Menarche, how old were you when your start to get them? Menstruation cycle. How long do the periods last usually? LMP, when was your last period? Menorrhea, do you get lost? Dysmenorrhea, do you get period pain? And discharge, is there any discharge bed the periods? Complete the case report. One word need twists. Look at B and C opposite to help you. Case 15. And 45-year-old woman had been having prolonged period lasting for 8 days with the passage of for 9 months. And there was no feeling between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushness or right sweat, and her general health had always been good. She had taken the oral contraceptive pill until 8 years previously, when a Cooper Law was 15. She had had a normal pregnancy when she was 25. Complete the conversation based on the case history in B opposite. Doctor, what seems to be the problem? Patient, have been getting palpitation. Doctor, how long do you have them? Patient, for about 6 months, but I had hair problem for years with tiredness and shortness of breath. In the end, I could walk more than 100 meters without even to stop. I had to sleep on 3 pillows. I had a mitral valve re- replacement 3 years ago, and that improved things for a while. Make word combination using a word from each box. 2 words can be used twice. Look at B and C apposite to help you. Add with breast, atrial with fibrillation, cardiac with output, hair with failure on E4, and fighting with edema, and premature with bed. Write the work and patient all using to describe the symptoms below. Look at A, B, and C apposite to help you. Number 1, dyspnea, shortness of breath, arrhythmia, palpitation, orthopnea, breathlessness when lying flat, and oedema swelling. Complete the case report. Look at A, B, and C apposite to help you. Case 30. And a 16-year-old woman attended her GP's surgery complaining of breathlessness on excision. This had been increasing over the previous 8 months until it was producing problems at around 500-meter walking on the level. There was no history of chest pain. She had had several episodes of fast palpation which lasted 20 to 30 minutes and were associated with some shortness of breath. She had noticed some swelling of the anklet by the end of the day. Complete the table with form from A apposite. But a street make in front of the street, the street styled in each word. The first one has been done for you. Verbs: auscultate, examine, inspect, palpate, and percuss. Now, auscultation, examination, inspection, palpation, and percussion. Both the steps for examining the hair and circulation in order according to the 4-stage system. Look at A apposite to help you. Measure the hair size, pressure, Are there any murmurs? Oscillation. Feel the real pulse, palpation. Look for clumping, infection. Look the apex beat, palpation, and not any thrills, palpation. A doctor is presenting the case of the 43-year-old woman at the meeting in the cardiology department completed the test of the hair presentation. Look at B, a positive outlook. On examination, she was pyrexia with the temperature of the 38.5. She was short of breath. Her pulse was variably between 100 and 180 and was irregular in time and force. Her blood pressure was 130 to 80 and her GBP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were at present and there was no central or peripheral cyanosis. Her apex bed was displaced to the interior auxiliary line but still in the 50 intercostal space. Her heart sounds were very interesting. When she was initially examined, it was not that she had pain systole and mean diastole. Murmurs hurts best at the apex. When she was examined some hours later, there was a harsh spherical friction rub all over the percorium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation.